Hi, my name is Blake Anderson. I am a physical therapist assistant student at Jeff State Community College. Basically, what I'm going to be going over if I had a patient that had just recently torn their ACL and they had ACL reconstructive surgery. So let's start. Okay, to start off, this was a female in this certain scenario. It was a female. She tore her ACL playing basketball. The specific type of technique in this reconstructive surgery was bone patellar tendon bone graft, which is an autograft, which means basically they just took a portion of your quadricep tendon and basically replaced it. The biggest goal for this patient was that she could ultimately just return to basketball. Basically, what we're going to be going over is a patellar mob, what that is, why you should do it, and how to do it, a home exercise program, what I'm going to be doing one example of an exercise and why, and then going over some patient education. Okay, so patellar mob. Basically, what it does is it promotes increasing in the range of motion. It reduces stiffness and pain in the patella, which is your kneecap. Specifically, this patient was very hypomobile with her patella, which means it wasn't really moving around all that much, if at all. Her short-term goal is walking around her house without crutches, and long-term goal, of course, return to basketball. And this is a video of me demonstrating this. Okay, so I'll be using my beautiful fiance. I'll be showing you how to do a patellar mob. In this scenario, this scenario, this is in all directions for the ACL reconstruction. So you're going to grab the patella without injury, of course. You're going to grab the patella. You can have a superior glide, an inferior glide, a lateral, and a medial. The superior glide is going to help with extension of the knee. Inferior glide is going to help with flexion of the knee. Lateral will help with mobility and stiffness. And medial glide will help with lateral tract. Yeah, so basically to reiterate what that video said, superior glide is when you have the patella and you're pushing it superiorly up towards the body. That's going to help with extension. Inferior, you're pushing it towards the feet. Lateral, obviously you're moving it laterally. Medial, you're moving it medially. Okay, so the home exercise program. So the specific exercise that I chose, probably one of the more important ones to do, especially for her short-term goal, was weight shifts for side to side. Obviously promotes ability to ambulate. She's only able to ambulate. Weight bearing is tolerated with crutches, so basically she can put weight on her right side, but as tolerated, and it's pretty recent, so it's probably not going to be that much. Short-term goal, ambulate without crutches. Yeah, so basically, I will have a video after this, but you're basically going to be standing up, and just like in the name, you're going to be shifting your weight from side to side. And here's this video. Okay, so I'll be explaining the home exercise program for this scenario. It's a ACL reconstruction. So basically, you have something in front of them and to the side of them. So this is weight shifts. So they're going to have their feet about shoulder width apart. And basically, they're going to be shifting their weight from one side to the other side. And on each side, I'm going to hold it for about 35 seconds. They can do about 10 to 15 reps. Going side to side. They can do this daily, 3 to 4 times a day. This is for lateral weight shifts. And then you can do anterior weight shifts. I would probably have the injured or the ACL reconstructed side in front, so they can weight bear on it. For this, we'll do the right side. So again, first me leaning forward, leaning backwards. They can use this to weight bear as much as they can, or as much as protocol is for what it is at that point. Back, forward, and they're going to be like the lateral feet for about 5 seconds on one side for about 35 seconds. You can do this daily, 4 to 5 times a day. Again, anterior, posterior, and lateral weight shifts. Okay. All right, PT education, patient education. The main thing that I would educate them on would be the weight bearing status and how to properly use crutches. But another thing would be how and when to use their brace, how to control their pain and swelling, obviously. This is important because specifically the weight bearing with the crutches and how to use the crutches. But this is important because it's very dangerous, especially this close to post-op, to be able to use those crutches correctly. It can be dangerous for them and for the people around them. You really don't want them to re-aggravate that injury. And this is obviously how you do not want your patient using their crutches. Okay, so the prognosis, after a long time window of the rehab, I do think that she'll be able to return back to her prior level of function with, especially with her age and activity level. I don't think it'll be that big of a deal. Obviously, it'll be a big deal in the rehab window, but after that, I think she should be fine. So the time window for her to return to basketball with that type of injury is usually around 6 to 9 months. It can be longer, but with her age and again activity level, I don't see it going any past that long. And then so since she is so early in this post-op phase, she's only 3 days post-op. The next phase will be in week 1 through 3. So yeah. That is it, and thank you for watching.